Hello and welcome to Pisgah Health Today. My name is Angela Owen. It's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. We have a panel of special guests today, and it's my privilege to introduce to you, we have Sylvia Russell, who is the president of Close to Kids of Haywood County, Inc. Welcome to our program, Sylvia. Joining her, we have Lois Fulmer, who serves as the treasurer. Welcome, Lois.
Thank you.
We also have Chris Haywood, who is the volunteer who is in charge of the Bath Buddies. I can't wait to hear about this program. Welcome today, Chris.
Thank you.
And we have Wanda Kinney, who is the lead volunteer for families. I am so excited to have all of you ladies and looking forward to learning more about this organization. And Sylvia, why don't you start by telling us what is the Close to Kids of Haywood County?
I would be delighted to, and we're so grateful to you all, not only for the grant, but for having us on today. Thank you. We began Close to Kids in 2013, so this is our 7th year. Of course, a tougher year to be able to contact these young people in Haywood County. But Close to Kids is an organization that gives school clothes to those children and teenagers who are on free and reduced lunch. We invite their families to make appointments twice a year. They may come in, and the children and teenagers themselves choose 4 complete outfits for school, and there is no charge to that. We are a nonprofit organization supported entirely by this community, and the young people may choose on their own. Parents don't choose the 4 school outfits, which include 4 pairs of pants, 4 pairs of new underwear, 4 pairs of new socks, 4 tops, a dress for girls, jacket or coat if weather needs it, and a pair of shoes, sometimes a fun pair too, on top of the tennis shoes. Also just some freebies that they may come and choose for fun. I think we as volunteers have benefited from Close to Kids as much as the children and youth that we get to know. We are very privileged.
Well, if the excitement that I hear and the energy you're bringing today is any indication, I would absolutely affirm that. And what a tremendous program for these children to be able to come in and make selections on their own. It's like they get to go on a little shopping spree, but without having to bring in the financial resources along the way. Chris, why don't you tell us a little, how will the grant that Pisgah Health Foundation recently awarded help you in serving these children?
Okay, so we primarily had been focused on the outer appearance of the kids, but I thought it was also good if we focused on personal hygiene, because not only would they look good in the clothes that they were wearing, but we wanted them to feel good about their hygiene. So we came up with the idea of a bath buddy. And a bath buddy is actually just a number of toiletry items in a Ziploc bag. For the elementary school kids, it includes shampoo, a toothbrush, toothpaste, and soap. For the middle and high school kids, it includes those items plus deodorant. And the really neat thing about the Ziploc bag is that as these kids take them home, if they're in a household that has maybe 3, 4, 5 other siblings, they can actually write their name on their own Ziploc bag and kind of keep their items private, whatever, so that it makes them feel ownership to that. But I was at Big Lots one day shopping for items for the Bath Buddies, and I purchased 30 things of secret deodorant. And I told the cashier, I said, I have 30. They're all the exact same price. So you could just scan one and put in like 30. And she said, no, I can't do that. And I said, why? And she said, because we had to put scanners on each individual deodorant container. And I said, why would you do that? And she said, because this is like the #1 theft item in the store. So we're talking about secret deodorant that cost $1 a container. And that to me spoke highly of the struggles that people have with just personal care items. We take a lot of things for granted sometimes, but for those folk who are maybe living from paycheck to paycheck, they may have to make that decision between, do we buy deodorant and toothpaste this week, or do we forego those because we need food or medicine? And so it just seemed like the right thing to do. And the good thing about it was that all of the movers and shakers for our Close to Kids bought into the idea. And so the grant will help us continue to purchase the items that we need to make sure that every person that comes into the shop leaves with a bath buddy.
It's a powerful story that you shared as you talked about the shopping and the self-esteem that comes when people know they have the ability to have that personal hygiene. So well done in developing that program and meeting that need to really help these young people with taking care of the personal hygiene element. What a great need that you're feeling there. Lois, what else would you like for our viewers to know about Close to Kids, Haywood County? How can they come alongside you? How can they get involved? Just what else is good for all of us to be aware of?
Well, we operate on several levels. One is the donation of actual clothing. And from the very beginning, we were not sure that we were going to have enough people come in and give us clothes that we could repurpose and hang in our shop and feel good about. But as the years have gone by, we have had a tremendous amount of support from the community to get those clothes. And then we also knew that there would be times when those donated clothing did not meet all of our needs and that we would have to go out and purchase clothes, so that we also knew we were going to have to go to the community and ask for donations. And because it's such a wonderful, heartwarming thing that we do, we've had no problem whatsoever of donations from not only personal donations, but from churches and groups and all kinds of support. So we continue to need that, because as we go forward and continue to serve, we're going to need that help from the community as well.
Right. People can come along and get involved along the way. In the beginning, I think we spoke about how they impact on the volunteers as well. So Wanda, I'd love for you to just share some story, whether it's the story about impacting these young people or impact to the volunteers who are coming alongside and giving, or maybe both. Well, what's something to share with us?
Well, I think I have the best job because I get to work directly with the children, and to see their joy and their self-esteem being built for them to be able to come and shop in the store, because it is a very cute little boutique, and it has a room just for the girls and just for the boys, and we have a shoe room, and they actually get a shopping bag, and they are able to put their purchases in the shopping bag, which has their name on it, and they go into the room and shop for their tops and their bottoms, and it's their choice, and they get to try them on, and they come out and they model them. It's like a little fashion show, and they are so excited especially for the shoes. They love getting the new shoes because so few get new shoes. Our main goal is to build their self-esteem and confidence to be successful in school. Because if they're successful in school, then maybe it'll break that circle of poverty, and they'll be able to get beyond and know that there's something more for them. But the greatest thing that I can remember with the children is when they said, can we bring some of our things back that are still very nice, but we've just outgrown. And so they have the idea that they can also give back as well as receive. It's just a wonderful experience to see the joy on their faces. It is just amazing. So I do have the best job out of everyone.
It's a tremendous testimony, the complete circle coming in and being able to experience and have that self-esteem lifted up. I would love to hear so much more from you, and hopefully one day we can come over and do one of these live over there with you in Haywood County. Ladies, is there anything else that we have not shared today that you would like to share with our viewers before we wrap things up today?
I remember Chris calling Close to Kids her happy place. And we can say very honestly, all of us, not only is it a very happy place for our young people that come and families, but it is also a very happy place for us because we've had a chance now to meet a whole nother demographic in our community that we just dearly love to be with and be a part of their lives.
That is so well said.
Ladies, we all came together. I think Chris, as well as myself, we've been with Close to Kids since the beginning. And I think that we came together and we were strangers. We just volunteered. It was a presentation at my church, and I said, that's a wonderful organization. I'd like to be a part of that. But we came together as strangers, but now we're good friends. And so we feel like a family. We've got a Close to Kids family.
So many blessings just all around from what you're describing. Well, ladies, on behalf of the Board of Directors of Pisgah Health Foundation, I would like to say thank you to all of you and the other volunteers who are working so diligently to serve these young people over there in Haywood County. We're super excited to just see the impact that you're making. And thank you for taking time to be on our program today. It's been a delight.
Thank you, Angela.
Yes, thank you. We've enjoyed it.
We also would like to thank Wildflower Media for their creative and technical support in bringing these programs to all of you, as well as we want to thank the Board of Directors and the staff at Pisgah Health Foundation and the Physicians Roundtable. So many amazing people doing so many things to help improve the lives of Western North Carolina residents. Until we see you on the next Pisgah Health Today, stay well and be well.